Welcome to Easy Anatomy. I'm talking to you today about the blood supply of brain. Blood supply of brain. So, the source of blood supply of the brain is two major sources: the carotid system, and vertebro-basilar system. Let me change the title here, and we say blood supply of CNS, because I have to talk about the blood supply of brain stem, I have to talk about the blood supply of spinal cord, and all of this coming, as I mentioned, to major system, carotid system, and vertebro-basilar system. The carotid system represented here by internal carotid artery, vertebro-basilar system represented by vertebral and basilar arteries, and both of them coming from subclavian arteries. Subclavian artery give vertebral, and the vertebral join its fellow from other side, and together they form basilar. So this is subclavian and this is carotid. Okay, if we visit the base of the brain, and this is very important to start with what we see in the base of the brain. The base of the brain, you will find here is optic chiasma, optic nerve. The two optic nerves meet together and they form optic chiasma, then optic tract. Okay, and behind here you will find mammillary body, and as you know, until you get into the brain stem, thalamus and the brain stem. But this is just to look at this area where there is a point of anastomosis between both systems, carotid and vertebro-basilar. You will find the internal carotid artery coming here and form the carotid system. So here is the internal carotid artery. Okay. Then from back you will find basilar artery is going to split into the two major branches, which are posterior cerebral arteries. Posterior cerebral. So you have basilar and posterior cerebral. This is internal carotid artery. The internal carotid artery is giving this artery, which is anterior cerebral, and the anastomose with its fellow. Again, the fellow here is going to be what? The anterior cerebral artery. This is the anterior cerebral artery. Anterior cerebral artery. Okay. The other branch is going to be the medial cerebral artery. Medial cerebral artery. Medial cerebral artery. Then the internal carotid join or anastomose with posterior cerebral through this branch, which is posterior communicating artery. The posterior communicating. So now we have closed the circle. We call it circulus arteriosus. Circulus arteriosus. So you have posterior communicating artery, anterior communicating artery, anterior communicating artery, communicate or connect the anterior cerebral together, posterior communicating connect the internal carotid with posterior cerebral, okay. When we talk about the three major branches which are going to the brain, the anterior, the middle, and the posterior cerebral arteries, usually there are cortical branches which supply the cortical centers of the brain, and there are perforating branches. Those perforating branches are perforating the anterior perforated substance, which is located here next to the optic chiasma, and the posterior perforated substance, which is next to the mammillary body. This is mammillary body. Okay, so you will find that there are perforating branches coming from posterior cerebral artery, okay, and perforating branches coming from middle cerebral artery and the anterior cerebral artery, and they go perforate the brain substance, and they go inside the brain tissue to supply important area inside the brain tissue, especially the internal capsule and the corpus striatum and the thalamus, etc. So this is very important to start with, because circulus arteriosus is important anastomosis in the base of the brain between the vertebrobasilar system and the carotid system. The importance of this anastomosis, if there is any obstruction in any of these big arteries, there is always a way to compensate by switching the direction of the blood flow from one to another. Let us say that there is obstruction in this area. Okay, there is obstruction in this posterior cerebral artery here. So what would happen? It means that the blood pressure distal to this obstruction is going to be less. With the pressure gradient, the blood flow come back and fill this distal part, and any branch coming from here is going to be refilled again by this pathway. The same, if there is obstruction in the anterior cerebral artery here, it means that the blood can come from the other side and fill the distal part and then supplying this part of the brain. So this anastomosis at the level of big arteries is good, but unfortunately those perforated branches or this internal branches, there is no anastomosis between them. That's why those are end arteries. End arteries. The end arteries mean that if there is any obstruction in any of these tiny branches, the cortical area or the center of the brain supplied by this is not going to receive blood supply from any other alternative. So the circular arteriosus is good at the large picture, but unfortunately that's why we hear about a stroke, and this stroke is common because we have end arteries. The end arteries are those terminal branches. The terminal branch is coming from the big arteries. Okay, we're done with this introduction. Before I move forward to individual branches, I like to remind you how blood flow to brain is regulated. How blood flow to brain is regulated. Remember that there is auto-regulation. When I say auto-regulation, it means that these blood vessels have sensors. They have sensors, metabolic sensor, and also, or this is related to the level of oxygen tension, or CO2 level, and there is pressure sensor, changes in blood pressure. What does this mean? It means that if there is decrease in the level of CO2 or increase in the level of there is decrease in the level of oxygen or increase in the level of CO2, this leads to vasodilation of the blood vessels to allow more blood reaching to the brain tissue. The same, if there is decrease in the blood pressure or hypotension, there is reflex vasodilation to allow more blood coming to the brain. So it means that less oxygen, okay, less pressure, lead to vasodilation. Is there any negative outcome from excessive vasodilation? Yes. Excessive vasodilation might lead to edema, because excessive vasodilation can open the tight junction between the capillaries and the endothelial cells, surrounding pericytes and the glia cells, and lead to leakage and brain edema. So this is if there is any excessive vasodilation due to severe hypoxia or severe hypotension. Okay, so this is autoregulation. Let us move forward and go to individual branches, which are the 3 cerebral arteries. So we have 3 cerebral arteries. This is our major talk now. 3 cerebral arteries. I want to cover what are the areas supplied by those 3 arteries. Very simple and quick. Let us say that this is the lateral surface of the brain. This is the lateral surface of the cerebral hemisphere, and this is, if you remember, lateral sulcus, and this is extension of parieto-occipital sulcus or sulcus, depend on how you pronounce it, and this is the central one. And if you remember, this is the imaginary line from the pre-occipital notch here to the parieto-occipital sulcus, and this is the occipital loop. This is the parietal loop. This is the frontal loop, and this is the temporal loop. And these are the anatomical landmark between each loop: pre-occipital notch, parieto-occipital sulcus, and then we have central sulcus. Okay, let us go to medial surface of the brain. Here is the medial surface of the brain, the same cerebral hemisphere, but we're gonna flip it to the medial surface again. This is the lateral, this is the occipital loop, and here is corpus callosum extending from genu or rostrum body and the splenium. This is corpus callosum. Okay, then I like here to look at the inferior surface of the brain. If you remember, here is the orbital surface and the tentorial surface of the brain. Orbital and the tentorial surface. Let us fill the gap here regarding to the blood vessels. You will find that medial cerebral artery is traveling through the lateral sulcus and then split into upper and lower branch, or upper and lower division. Okay, the anterior cerebral, this is the middle cerebral artery. Middle cerebral artery. Anterior cerebral artery is traveling through callosal sulcus here and gives several branches. Okay, then the posterior, this is the anterior cerebral artery. Posterior cerebral artery is traveling through calcarean sulcus or sulcus, then parieto-occipital, then here is a calcarean. Okay, so this is the posterior cerebral artery. The anterior cerebral artery is supplying, as you see, the frontal loop, parietal loop, and the temporal loop. To make it easy, is going to supply the lateral surface of brain except the upper part. Upper part is going to be by anterior cerebral artery, and except this part, which is occipital loop. So other than that, is supplied by the middle cerebral artery. So to summarize it in simple way, middle cerebral artery, the trajectory of middle cerebral artery, lateral surface of cerebrum, except upper inch or upper part and occipital loop and also the lower part also here. Okay, the upper part is going to be by anterior cerebral artery, the lower part and the occipital loop by posterior cerebral artery. So if you come from the medial surface, the medial surface is supplied by, again, anterior cerebral artery and extend to the upper part of the lateral system, of the lateral surface. Occipital loop supplied by posterior cerebral artery, and this extend also to the tentorial surface of the brain and part of the temporal loop. If you go to the inferior surface, the orbital is divided into the medial and the lateral. The medial part by anterior cerebral artery, the lateral part by middle cerebral artery. Tentorial surface is mostly by posterior cerebral artery. Okay. You need to translate this information into function. So if I ask you what are important to cortical area supplied by the anterior cerebral artery, the quick answer is what? Motor area, okay, in the precentral gyrus, frontal eye field area, motor speech area, okay, sensory area, except the motor and the sensory area, except the area related to lower extremity, because this is reserved to anterior cerebral artery. Remember the paracentral lobule here in the medial surface, paracentral lobule in the medial surface of the brain. So this is medial surface, this is lateral surface, just to remind you. So if you wanted to translate this, middle cerebral artery is supplying what? Supplying again motor and the sensory area, except this for lower extremity and the perineum. Second, motor speech area, frontal eye field area, correct? What is in the temporal lobe? Hearing and the hearing association area. Okay, what is in the insula? Remember that the middle cerebral artery traveling over the insula in deep through the lateral sulcus. So gustatory area. This is just general information before you go into depth. Then the anterior cerebral artery is going to supply the medial surface. What is in the medial surface? Here is the medial frontal gyrus, personality, and also paracentral lobule, motor and the sensory of lower extremity, corpus callosum, most of corpus callosum, and this is commissural fibers, which is commissural fibers. Okay, important to connect area of right with area of left side. So this is the most important part of middle cerebral artery. In addition to that, there are penetrating branches or perforating branches. There is striate arteries, medial and lateral striate arteries. The medial coming from the anterior cerebral, the lateral coming from the lateral cerebral, from the middle cerebral, and those striate arteries are going to supply again corpus striatum and the internal capsule, and I will talk about that later on. Okay, so this is important information to remember. Coming back to posterior cerebral artery, here is the posterior cerebral artery supplying occipital loop, and the occipital loop is related to what? Vision center. Okay, When I say vision center, include the primary and the association area, the sensation itself and the interpretation of the sensation. Okay, so this is in the occipital loop. So this is summarize the thing. So posterior cerebral artery vision center, this is motor and sensor of the lower extremity. This is everything on the lateral surface. As I mentioned, motor sensor of the body, except the lower extremity, motor speech area, frontal eye field area, hearing area, gustatory. And I will have a special lecture about the lesions associated with obstruction of these arteries. This is going to be separate lecture. Okay. So straight arteries, just if a quick reminder, if you go to the lateral, the coronal section of the cerebral hemisphere, this is middle cerebral artery here in the lateral sulcus or sulcus. Then remember what we have here. There is a cavity here. This cavity is lateral ventricle. Then there is caudate nucleus, the head of caudate. Then we have lentiform nucleus. Then we have in between, this is caudate, this is lentiform nucleus, and here is internal capsule. Internal capsule. The internal capsule is very important area where most of the projection fibers travel through it, connecting a higher center with lower center. So middle cerebral artery is located here. This is MCA. Anterior cerebral artery is located in this area, in the longitudinal fissure. This is anterior cerebral artery. So anterior cerebral artery send medial striate artery, and this one send again lateral striate arteries. So lateral striate arteries, and this is medial striate arteries, and those the one which are together supplying this one and this one, supplying what? Internal capsule and corpus striate. And we will talk about the effect of injury later on. Then the posterior cerebral artery sending penetrating branches and the thalamo-geniculate artery, from the name is going to diencephalon or thalamus, and geniculate bodies which are part of thalamus also. So this is the PCA, posterior cerebral artery. Those arteries are important arteries when we come to talk about cerebrovascular accident and the stroke. So I keep this for another lecture. Okay, striate arteries and thalamo-geniculate artery, perforating branches of PCA, posterior cerebral artery. Before I leave this part, let me quickly review the vertebrovascular system. So this is vertebral artery, join vertebral artery from the other side, forming basilar artery. And the basilar artery is going to split into posterior cerebral arteries as two terminal branches. So this is basilar, this is vertebral. If you want to take vertebral down to the neck, it's coming from where? From subclavian artery. Okay, so what are the branches coming from? Each one of them, major branches. Major branches I start with the vertebral with one artery which has this shape, Y shape, is called anterior spinal artery. Anterior spinal artery. It's one. Has two stem coming from two vertebral arteries. Then you have posterior spinal artery, posterior spinal, and as you see we have two. Posterior spinal. You have two. Then we have pica, and this pica is called posterior inferior cerebellar artery, or pica, posterior inferior cerebellar artery. Then we have some other branches, medullary branches, which supplying the medulla. Okay, so those are the major branches coming from vertebral. Distribution of these arteries, the anterior and the posterior spinal artery. Here is the cross section in the spinal cord. Pay attention to what I'm doing now. Okay, this is cross section. Here is a gray matter which is H shape. Okay, forgive me, I am not good in drawing, but I'm trying my best. So this is anterior and this is posterior. This is cross section of spinal cord. The anterior two-thirds supplied by the anterior spinal artery. So anterior spinal artery supplying anterior two-thirds. Anterior two-thirds of this cross section. Posterior spinal arteries, which are two, supplying posterior third. What does this mean? It means that the lateral column of the white matter, the anterior column, the ventral horn, the lateral horn, all this are supplied by the anterior spinal artery. That's why we have big syndrome called the anterior spinal artery syndrome. Okay, so we need to pay attention, because later on when you learn about what are tracts traveling through the lateral column or ventral column, or what is the function of the ventral horn or lateral horn, you need to understand that this area is supplied by anterior spinal artery, and if there is obstruction in this guy, it means that tracts here are going to be jeopardized or affected. Posterior spinal supplying posterior column and the posterior horn. And you know what is the posterior column syndrome. When it comes to clinical discussion, we will cover this part. Posterior inferior cerebellar artery is very easy to remember. If you translate this name, posterior inferior cerebellar, it means supplying what? The posterior part of the inferior surface of the cerebellum. Posterior part of the inferior surface of cerebellum. Then coming to the basilar send pontine branches from the name, going to pons, and also giving ica, which is anterior inferior cerebellar artery. It means supplying the anterior part of the inferior surface of cerebellum. Superior cerebellar artery, superior cerebellar artery, supplying the superior surface. So we have three cerebellar arteries, one for the upper surface of cerebellum, and two for the inferior surface, the anterior inferior cerebellar and the posterior inferior cerebellar. And you have pontine. Then we have the two terminal branches, which are posterior cerebral artery. Okay, this vertebrobasilar system, if you can summarize what are the area of CNS supplied by vertebrobasilar system, you will see how big is the area supplied by it. So the vertebrobasilar service supply: 1. Occipital loop, 2. of the cerebellum, 3. brainstem, 4. spinal cord, 5. diencephalon. So this is vertebral system, and the rest, which is the frontal, parietal, temporal lobes, the anterior part of the brain, supplied by internal carotid artery. And by the way, this is also huge area and important to cortical area. Okay. I hope that this summary is going to be the base for our discussion when it comes to clinical discussion related to stroke and cerebrovascular accident. Thank you.